Good morning, everyone. Welcome. And we're going to be talking today about how TeloYouth touches such a powerful, powerful system and try to help you understand some of the things that can happen when our endocrine system is out of balance. So, the endocrine system is very, very powerful. It releases hormones into our system, and our hormones play such a key role in so many facets of our overall well-being. They provide us energy. When we think of the adrenals and cortisol, they affect, and hormones can also affect and control our emotions. Think about this. Women working through menopause sometimes don't feel like they're the same person, like they've been taken over by another entity when their hormones are out of balance. Or aging men, they have a similar experience called andropause, where they can experience a significant drop in testosterone, and then the overall cascade and feeling of not feeling like yourself can happen. So hormones have many, many components, and they also have a spiritual components. When we talk about our energy centers or our chakras, we have those glands that are connected to all of those different chakras. Like, for instance, let's take a look at our pineal gland. Our pineal gland is part of the endocrine system. It's also called our third eye, but it's also where we produce melatonin, which is our sleep hormone. And when it's calcified, it affects female hormones, sleep, moods, male hormones. I mean, it's just so complex. Our pituitary gland is considered our master gland, and it regulates and monitors the function of all of those hormones. So they're very, very powerful, very complex, and very interconnected. Think of it this way. Every cell in our body has hormone receptors. So when they're out of balance, we feel out of balance, physically, emotionally, and sometimes even spiritually. Let's look at our energy. We think that we lose energy as we age, and that's the old energy myth. However, we age because we lose the ability to make energy, and our endocrine system is part of this big energy machine that helps us to feel like we have more energy. So we can reverse this, and we have been reversing this with TeloYouth. Dr. Chris, can you talk a little bit about our endocrine system?
Sure, I'd be glad to. And I'd like to start out just the big takeaway from understanding TeloYouth is the foundational ingredient is the fertilized tissue extract, the FTE. And it's a pre-embryonic extract that essentially is going to help you understand that it introduces the formative forces that form the body. And what few of us really realize that when we're born, we're primarily just a big head. It's almost like the head is half the body of the baby. And then these formative forces, descend and they work through the endocrine glands, and you see the changes in the body, and these changes are indicated with different physiological functions. It's like between the ages of 5 and 7, the child loses the baby teeth, and then the adult teeth come in. So you see the formative forces descending from the head area into forming the body. And then somewhere between 12 and 14, we reach puberty. And so again, these formative forces are creating the adult characteristics that are reflected in the endocrine system. And by age 21 to 25, all these signal molecules that help regulate these formative forces, you see these changes, and it goes through the endocrine glands. The chemistry of our digestion, our immunity, and puberty for reproduction, all of this is happening. So you see the thyroid there in the neck area. This is the metabolic function. And then The immune system is by the thymus there in the middle of the chest, and then the energy of the body is reflected through the adrenals that sit on top of the kidneys there. So very, very specific areas that the TeloYouth helps work with, balancing these areas, mediating stress in the adrenals, helping the thyroid with its metabolic function. And then, of course, when you reduce the cortisols, as Dr. Tina mentioned, the pineal gland, it becomes much more efficient in releasing its melatonin for the sleep and repair that needs to happen. So let's talk a little bit about the balancing of the systems. The systems go through a response mode to the energy needed during the day, and it's kind of the stress response. And this is the sympathetic side of the endocrine system. And then you have the parasympathetic side, which is where we thrive and respond. This is where we digest our food more ideally, or much more efficiently, when we're in the parasympathetic mode. This is where we sleep in the parasympathetic mode. Obviously, we don't need to digest and sleep when we're in some type of stress response, and this always takes priority. So this whole dynamic that goes through the endocrine system is about balancing between making energy and balancing between regenerating and repairing from just the stressors of the day. So let's talk a little bit about how taking TeloYouth helps a person reestablish their regulatory functions, because that's what the endocrine system does. It helps to regulate the body probably more than any other system with its powerful hormones. And we have a guest on today. His name is George, and I have a very close relationship with my dear brother, George. And George, welcome to the call. Thanks for joining us here today.
Well, thank you for having me.
You want to share a little bit about your experience? I know you wanted to share a little bit about the impact of taking medications and that are prescribed by your doctor, and then all of a sudden you start to regenerate the body with good lifestyle habits and taking TeloYouth. I know in your case, it was an issue with the prostate, and all of us men after the age of 50, it's an area that we have to be, concerned about and work with our health practitioners. Do you want to share a little bit about what happened with you after you started taking your TeloYouth?
Yeah, about before being introduced to TeloYouth, I was, for about 2.5 years, I was taking not a testosterone, but a prostate medication. And then I started taking TeloYouth. And after about 2 weeks, I started every week, I would get some sort of dizzy spells, or, I'd feel lightheaded. And this continued on. So anyway, but after about a month, I had a fainting spell. And so, that concerned me. And first I said, okay, maybe it's due to some low blood pressure or something else like that. But then again, I had another fainting spell. So I remember reading the label on the prescription, where one of the side effects was dizziness and lightheadedness. So immediately I said, oh, I better go see the doctor and see what's going on here. Well, I went to the doctor, and he immediately took me off the drug. He said he couldn't accept having those kind of reactions to it. So anyway, I stopped taking the drug, and then as time went on, then the dizzy spells were eliminated, and I started feeling normal again. And this is when I really realized that the side effects that we hear about on all these um, television advertisements, they need to be taken serious because of, especially in my case, you know, having fainting spells. Just imagine if you were driving along the road and you fainted, or you fainted in the bathtub or whatever. It could be very, very dangerous. So anyway, the TeloYouth, after discussing it with Dr. Chris and Dr. Tina, realized that it made changes in the body. The body was telling me something. Things are changing, and ever since then, I haven't had any of those spells, and I realized the body knows. The body told me what it needed, and I feel like I'm really getting back into the rejuvenation cycle.
That's great. I want to share a little bit from a medical perspective is that, doctors are more used to medications losing their effect over time, not getting stronger. And this is what happens when the body starts to take over its regulatory function and also becomes cleaner, more sensitive to any type of toxin, because medication is a foreign substance to the body and it tries to repel it. So this is why we caution everyone that if you're on a medication, work closely with your doctor and understand that it could become too strong, and you want to make sure you either reduce it or get off of it altogether. And we get desensitized because we're watching TV and we're always seeing these commercials with all this fancy stuff going on, that these medications are going to make your life so much better and happier, and we lose sight of the side effects and the potency of the medication. Dr. Tina, anything you want to share or ask?
Well, thank you, George, for sharing that, because the side effects that you are experiencing, yes, they're very, very serious, but plugging into these calls and being aware of, if you are on medications, always go to the internet and print out your contraindications and have them there, so that if you are beginning to feel those, you know that your body's taking back your own regulatory functions. And Dr. Chris, you made a good point. Doctors don't know how to deal with a regenerating body. That's not what they're trained to do. They've been trained and educated to deal with a degenerating body. And we've seen such a push, especially with our community here, that we are all taking back our own knowledge, our own power, being connected with our own bodies, taking our TeloYouth, getting back to regenerating. And it is a very sensitive situation when you do need to work with your doctor. So congratulations, George, because your body is regenerating. And can I ask, what young age are you?
I'm at the early age of 75.
Okay. And
I'd like to just make one comment. It changed the quality of life while I was going through the prostate issues and those kind of things. My quality of life had really deteriorated, and I'm not one to sit on the couch and vegetate. But anyway, my quality of life had really changed through TeloYouth, but also it made me do some lifestyle changes to help the whole body, rejuvenate. And I just, it's probably one of the first supplements I'd ever taken. I've taken supplements almost all my life, that I really felt something really taking place in my body. And it's just been really a life-changing experience for me.
oh, great. Well, thank you, George.
It's really a great point that George makes, as far as you get motivated to re-engage with life. You know that lifestyle habits are important, but then you just don't want it. You're not motivated to do it. So you start doing everything better. You start taking care of yourself more. You eat better, and you take more responsibility for how the body works. And because you see the benefits, it's something that you recognize. And why we always tell people take that health evaluation, test and see where you're starting before you begin TeloYouth, and then how things change. And it's a great motivator to keep doing all the good things you need to do for a good life. So thanks again, George.
Thank you.
Yes, thank you, George. When we're talking about the endocrine system here, and our hormone imbalances can show up when our endocrine system is being challenged. Look at all of the different things. There are actually more things that aren't even on this list. We just put some of the most common experiences that people are having, and that's, look at the mood swings, blood sugar levels, the inability to handle stress, ongoing inflammation, adrenal fatigue. Like George was saying, his quality of life, he was, sitting on a sofa or didn't feel motivated, and the mood swings and thinning hair. All of us can relate to this. Once we hit a certain age, we feel like our hair is thinning. Well, a lot of this has to do with the endocrine system changing. Osteoporosis. This is at an all-time high, and the medications that women are taking for osteoporosis over time actually causes more brittle bones. So, when we start bringing our body back into balance, just again, please plug into working with your doctor if you are on medications, dealing with any of these challenges here, and see about when, if and when you could possibly wean off of them. Look at the unexpected weight changes, declining libido, so many things, and yet it affects us big time. When we look at some of these symptoms, we really can get thrown off and not feel like our normal selves. And TeloYouth can help rebalance, especially by working on that cortisol first, getting us out of that stress mode.
So here you see the ingredients, and again, the aloe is so key in helping us to make energy more efficiently, because again, it works with helping to regenerate and repair because of its support to the immune system. And making energy is so critical. And when you lose that blood sugar regulation, you go from just making, the energy unit called ATP, just 30 units, versus the ability to make 130 units with using the body more efficiently and breaking down fats instead of just carbohydrates. So you see the aloe is the super healer, and then today's challenges with the stress on the endocrine system coming from the electromagnetic fields. The chaga is a super protector for the whole body, but especially for the sensitive endocrine glands. The endocrine glands have a great ability to create energy and power in the body, but at the same time, they're very sensitive to stressors. So the toxins, and especially now the new radio frequencies that we're getting from electromagnetic fields, is very damaging. And then the rhodiola is we call it a super relaxer, but it again is helping us adapt to stress throughout the body, and especially the nervous system. So these three ingredients are very key. Next, you see the FTE, and again, I introduced the call saying that this ingredient alone introduces the formative forces so your body can repair, regenerate, and rejuvenate. Dr. Tina, anything you want to add on this page?
Well, especially with the FTE and the clinical studies that have shown that it can reduce that cortisol. And when we reduce the cortisols, and we showed that chart where Dr. Chris was talking about our hormones, and on the left-hand side, we're in the stress mode. And we need to have a balance between the stress mode and which is the sympathetic versus the parasympathetic side of our hormones. If we are stuck in that stress side, we cannot move over into the parasympathetic side. So we have to be able to unlock that cortisol, high cortisol function and bring it down into balance. And that is what our FTE does, as well as super rejuvenates, activating our stem cells and recharging our body. And then we have the super glue that holds our body together with our marine collagen and supports the super information highway for all that communication that needs to happen. And then we also have our super transporter, and the rhodiola is amazing when we talk about helping with cardiovascular health and helping our blood vessels relax for improved blood flow. And wherever the blood goes, we have to have that circulation, right? All of our cells, all of our blood needs to touch every area of our body. And the rhodiola assists with that. Dr. Chris, do you have anything else?
I think this helps tell the story of George's experience with TeloYouth, how you see these ingredients that are cleansing the body, detoxifying it, boosting its immunity, but then you see something like the super transporter that increases the blood flow. And so essentially you're increasing the potency of anything you're doing, whether it's medication or just taking food. You don't need as much because your body works more efficiently. And so it's a great story to share with taking TeloYouth and what it does for the body.
Yes, and we talked about melatonin earlier, and being able to, reduce that cortisol helps our melatonin increase. And the melatonin, again, is so connected to our pineal gland, which is our third eye, which is that spiritual center, as well as the pineal being able to manufacture our melatonin. So when we have that melatonin that comes back into balance, that's when we get to have that deep rejuvenation sleep at night as well. All of these key factors are so interrelated, and our ingredients are supercharged, synergistically combined in order to help the body balance so many different systems. Okay, and you go ahead.
I was going to say, thank everyone for joining us today, and know that these calls are for educational purposes only and cannot be considered a substitute for professional advice. So they're not designed to prevent, diagnose, cure, or treat any form of ailment. And just as George did, he went to his doctor to understand and how to work with his medications. And we recommend that for everyone working with a qualified professional.